Thank you for that warm introduction. I am so pleased to be part of Nothing But Net's 2021 Leadership Summit and to welcome you all today. It is hard to believe that it has been more than a year since many of us were together in Washington, D.C. for last year's Summit and Advocacy Day, which took place just days before COVID-19 was declared a pandemic. And it has been such a challenging year on so many levels. So on behalf of all of us at the United Nations Foundation, I cannot thank you all enough for your perseverance, your commitment, and your presence today to ensure that we protect and build on critical progress, accelerate our work together to achieve the Sustainable Development Goals, especially Goal 3 on good health and well-being for all, and that we truly unite for health. We know now more than ever that the really big challenges, whether that's COVID-19, systemic racism, climate change, or malaria, one of the world's oldest and most pernicious diseases, require big thinking, acting, collaborating. That's why it is so gratifying to see all of you coming together from across the country and around the world as individual citizens, as leaders of global health organizations, as private sector partners, united in your determination to end malaria and to create a healthier and more equitable world. And your work matters. Your voices matter. Your advocacy matters. Lives, both right now and in the future, are at stake. And I just want to thank you again for taking the time and making this such a priority in your work and lives. With that, I'm delighted to welcome you now to the Unite for Health, Leave No One Behind session and introduce you to our two esteemed guests, Peter Sands, the Executive Director of the Global Fund, and Valentina Buch, UNICEF's Global Malaria and Health Partnerships Advisor. I won't regale you with all of Peter and Valentina's accomplishments because there are many, but just a few highlights. Peter Sands, before becoming the Executive Director of the Global Fund to fight AIDS, tuberculosis, and malaria in 2018, was the CEO of Standard Chartered PLC, one of the world's leading international banks. He's been a research fellow at Harvard University for years, worked on a range of policy innovations in financial markets, and long also appreciated the need to invest in global health security and pandemic preparedness. He's been an extraordinary leader of the Global Fund, leading it to its most successful replenishment yet in 2019, where donors pledged a historic $14 billion over 3 years and committed to save an additional 16 million lives, something everyone on the line today knows about and advocated for. The Global Fund is, of course, a crucial player in the fight now against COVID-19, and I'm sure we'll hear more about that shortly. Valentina Buch is the Global Malaria and Health Partnerships Advisor at UNICEF. UNICEF is arguably the best-known UN agency working in over 190 countries to promote the rights and well-being of children in all respects. Valentina has spent much of her time on the malaria front lines, working in endemic countries such as the Democratic Republic of Congo, Kenya, and Madagascar, and in areas ranging from net distribution to integrated community case management to supporting community health systems. Welcome to both of you today, and thank you again for taking the time to be with us. So with that, I'd like to jump right into the conversation, and I want to start with some background. So Peter and Valentina, the Global Fund and UNICEF both have played such a significant role on the front lines of the malaria fight. So to start off, can you give us just a brief snapshot of your organization's historical roles and your footprints now when it comes to addressing malaria? And Peter, I want to start with you.
Thanks, Elizabeth. And can I start, actually, you mentioned the replenishment and the Global Fund raising a record $14 billion. And I want to start by thanking all the Nothing But Net's grassroots champions, advocates, partners for the fantastic support we got, and which was crucial to getting particularly the US element of that $14 billion. For those of you who are new to the Global Fund was created in 2002 and raises, well, if you do the math, 14 billion over 3 years is roughly speaking $4.7 billion a year from both donor governments and the private sector to fund the fight against HIV/AIDS, TB, and malaria. And the Global Fund represents over half of all international financing for the fight against malaria. Specifically from the US, Congress pledged to fund in the last replenishment 1.56 billion per year for the period 2020 through to 2022. And that's a 210 million increase per year over the amount we raised in the previous 3 years, so 2016 to 2019. And Congress's leadership on this was absolutely instrumental in getting other donors to step up as well. So even before COVID, we were incredibly excited at working alongside the other biggest funder of malaria programs in the world, the Presidential Malaria Initiative, PMI, because we had the opportunity to step up the fight. Of course, since then, COVID has happened and created a very different context, which I'm sure we're going to be talking about, in which to combat malaria. But what I would say is the Global Fund is absolutely committed, not just to mitigating the impact of COVID on the fight against malaria, but actually to be sustaining the momentum towards ending the epidemic and saving, of course, millions of lives.
Thank you, Peter. Valentina, let me turn to you.
Thanks so much, Elizabeth. I'd also like to really start by thanking the United Nations Foundation and the Nothing But Nets grassroots partners and donors for their support. You have truly been our greatest champions, as this particular campaign has been our most consistent donor, with nearly 20 million provided to support our country offices to deliver on the front lines in complex operating environments. Malaria is of particular importance to UNICEF, as it is the third largest killer of children, right behind pneumonia and diarrhea. When I started working in malaria nearly 20 years ago, we used to say a child died of malaria every 30 seconds. We've managed to extend that interval to 2 minutes, but that still means we are losing nearly 300,000 young lives every single year. Malaria is also particularly affecting pregnant women. We know that every year, approximately 125 million women living in malaria-endemic countries throughout the world become pregnant. At least 10,000 of these women and 200,000 of their infants will die as a result of malaria during pregnancy. UNICEF is therefore focusing not only on children, but also on pregnant women. UNICEF also particularly is focusing on socioeconomic determinants of malaria. Malaria is a disease of poverty. It is also a disease of war and famine. Children who are malnourished are far more likely to catch and die from malaria. We are thus working across all the different areas where UNICEF is present in health, nutrition, water and sanitation, education, and health system strengthening to ensure that we can bring a comprehensive and holistic package of services to children, to mothers, and to their families to ensure that we are addressing those who are most affected by malaria and most vulnerable. Take, for example, education. When kids are sick, they cannot go to school and their parents cannot go to work. We also have seen the risk of severe malaria to cognitive development. UNICEF is therefore working across the spectrum to reduce school absenteeism and ensure parents can continue to receive income to prevent malnutrition, pay for health services. For me, it's particularly important because both my children were actually born in Kenya. And so when I became a mother in a malaria-endemic country, it became a very particular impetus, and it put a fire in my soul to really work across UNICEF's entry points to really drive malaria out. I was very, very lucky that I could have a safe birth and that my children could be protected from malaria. But I know that on the 2 days my children were born, their birthday twins didn't have the same services. And so this is a very personal fight for me.
Thank you so much, Valentina. I want to thank Peter for underscoring the thanks and appreciation to our grassroots champions and also congressional leadership in the United States, the two obviously being really related. And Valentina, you're really powerfully talking about the intersectional way that malaria plays out across every issue that affects children and families. I want to turn to the COVID-19 pandemic and the impact on malaria of it. We all know too well now how much COVID-19 has posed a significant threat to progress against malaria, indeed a threat to all of the work against other vaccine-preventable diseases and other health conditions. I recall hearing WHO's warning at the start of the pandemic that malaria deaths could double due to COVID-19. And my understanding is that thanks to the amazing work of people on the front lines, to countries, to some flexibility among donors, we've likely averted that worst case scenario, but we do still anticipate an increase in malaria cases and deaths. So I'd like to hear more about how the pandemic has impacted your programs, the adaptations you've had to make, and the state of play now. And I'm sure everyone would also really love to hear the main lessons you feel we've learned, especially as we think about beginning to build back and to build back in a different and stronger way. Valentina, I want to start this time with you.
Thanks so much. So let's start with some of the big, scary numbers. COVID has put 168 million school children out of school. We know that they have been unable to access their schools for nearly a year. We also know that child poverty has increased. We see that the children living in monetarily poor households has increased by about 140 million by the end of 2020. And unfortunately, we've seen that as of November 2020, 6 to 7 million children under the age of 5 could suffer from wasting or acute malnutrition. Malaria is unfortunately highly interlinked with malnutrition. We know that at least 50% of malaria deaths are underlain by malnutrition. I know these numbers are horrible. I know these numbers are scary. However, knowing these numbers and knowing where these children are has helped UNICEF to really prioritize our programming. Most of the investigations that we've been doing at country level has shown that disruptions to essential health services are driven by fear. Communities are fearful of seeking care for their sick children with fevers because they're afraid of being infected by by COVID. Unfortunately, they may have malaria, but they're too afraid to go and seek care. So a few of the areas where UNICEF has been working is helping train community health workers. We've been working with donors like the Global Fund and many others to ensure distribution of personal protective equipment such that essential health services, including malaria case diagnosis and treatment and prevention, like bed nets, and their campaigns could go ahead in safety. We've also been using new digital technologies, so looking at new ways to empower communities and healthcare providers through SMS technologies. So we are learning everything that we possibly can from COVID to build back better.
Thanks so much, Valentina. Peter, your thoughts?
Yeah, just building on Valentina's comments and sort of stepping back a little bit, we were all very worried about what was going to happen to things like BedNet campaigns and to the supply chain. And there was a huge amount of effort across the partnership, from people in country to global agencies like UNICEF or the Global Fund to PMI and so on, to both secure the supply chain and actually work with local partners on how to adapt BedNet campaigns to the realities of a COVID and lockdown context. And so, for example, most BedNet campaigns went from having a model where typically you took the truck with the bed nets to the village center and then everybody gathered to get their bed nets, to a model where you had volunteers on motorbikes taking bed nets to individual houses. And that worked. And actually, although some of the campaigns last year, and we were tracking 38 different campaigns in different countries, got a bit delayed, most of them actually happened and happened at the right scale. But it cost more money. We had to be issuing personal protective equipment, PPE, to the health workers involved. We needed more motorbikes. And it took more time to actually do this kind of door-to-door delivery. One thing we did is, on top of our normal funding, is we mobilized an additional $1 billion last year to deploy to help countries both respond to COVID itself and to adapt their HIV, TB, and malaria programs, and to pay for exactly this kind of adaptation that I described with BedNet campaigns. Going forward, though, I think we have to acknowledge that in many parts of the world, we're still in the middle of the crisis. I was just looking at the numbers today, as if deaths from COVID-19 in the first half of 2021 will probably equal or exceed deaths in the entirety of 2020. And I suspect that the knock-on impact on malaria, HIV, TB, and other diseases will also be greater this year than last year. And I think the bit of the malaria interventions that I'm most worried about and concerned about, and again, Valentina touched on this, is case management at a community level. We are incredibly dependent on the incredibly dedicated, committed, individual community health workers who go into villages, diagnose children and pregnant women, treat them. But if those community health workers get sick with COVID, there's very little backup. And the system can kind of fall apart extremely quickly. And that's why it's things like PPE, protecting our health workers, is extraordinarily important for sustaining effective case management for malaria. Prompt, well-managed case management is the difference between a child getting a fever and then getting better, and then a child dying. It's that kind of direct and straightforward. So one thing we are actually very encouraged about, and again, the grassroots champions, the legislators in Congress have played a fantastic role here, that within the American Rescue Plan Act that's just been signed by President Biden, there's $3.5 billion for the Global Fund's COVID-19 response, which includes actions to mitigate the impact on malaria programs. And so we are now, thanks to the generosity of the United States and to your extraordinary advocacy, in a position where we can not just continue, but step up our support to countries that are wrestling with this perfect storm of pressures on their health systems, devastation to their economy, and there's a real urgency about doing this. We need to be very focused this year on managing that knock-on impact on malaria, particularly in the poorest and most vulnerable communities in the world.
No, thank you. And I hear among all of that two really big themes. One is about agility and just the ability to have organizations and resources organized in such a way that you can adapt to really fast changing circumstances in ways that deliver the most essential things to communities that most need them. But the other is stamina and really seeing through this task, because it's almost the most risky time now when there are vaccines rolling out in some countries at really extraordinary rates, that people begin to feel that it's possible to shift gears when actually the job isn't done. So I really appreciate both of your thoughts on that. I want to go a little deeper on this question of equity. COVID-19 has exposed an awful lot about health inequities, and it's exposed it everywhere from the United States to globally, with some populations much more at risk, with much less access to testing, treatment, vaccines, et cetera. And I recognize every country's version of health inequity is different, but I want to hear your thoughts on how we overcome those barriers. Some of them have been around for an awfully long time. How do we do better to ensure that health is understood by everyone as a basic human right, that we truly need to unite for health, that we don't leave anyone behind, that that's important for all of us, whether it's overcoming COVID or ending malaria? And I want to turn, Peter, actually to you first on this one, and then Valentina.
You're absolutely right. COVID-19 has exposed sharp inequities both within individual societies and across the world. And while I don't like those inequities at all, I think it's good that a sharp light is being shone on them, because the reality is that the fact that we're still fighting malaria, a disease that we know how to win against, where we've demonstrated in multiple countries around the world that we can get rid of, is itself a kind of shocking inequity. This is a disease we know how to beat. We know that doing so makes a phenomenal difference. And yet, actually, the world as a whole has put relatively little money into malaria. I mean, we deploy, roughly speaking, about $1.2 billion a year, and we're by far the largest provider of funding for malaria. But in the scheme of what is being spent on COVID, this is not one order, not two orders of magnitude smaller. It is a tiny, tiny fraction. And so I hope that COVID will force us to look harder at how we think about health as a human right, the inequities of access to health. We have a bad record as a world, frankly, of thinking of things as health security threats, as pandemics, when they are, to put it bluntly, killing people in rich countries, and then thinking of them as unfortunate humanitarian development issues when the same diseases are no longer killing people in rich countries, but only killing people in poor countries. And that's true of malaria. It's true of HIV. It's true of TB. And we really shouldn't be happy about that. I mean, it's outrageous, really. These are diseases we have demonstrated we can win against. And I hope that, well, the first thing I hope, we can't do the same with COVID. When we have, high vaccination rates in the rich countries of the world, we can't lose interest and suddenly say, oh, well, COVID now is just a kind of long-term development humanitarian issue we're going to have to deal with over the longer term. We've got to finish the fight against COVID. And while we're about it, why don't we use it as an impetus to really step up and finish the fight against these other diseases?
Well, that is a call to action if ever there was one. Valentina, your thoughts?
I think if we make the comparison between COVID and malaria as both a disease of individuals and a community level disease. And by that, I mean, humans are the reservoir for malaria. When one person is infected with malaria and they don't have access to a bed net, they don't have quick access to case management and diagnosis, they can infect thousands of people if the mosquitoes are present. Guess what's exactly the same? So is COVID. One person, one asymptomatic person with COVID can decimate nursing homes, whole communities. So if we start thinking about this individual community paradigm, and exactly as Peter said, how do we pull together? How do we pull that bright light to look at those communities, those poor, fragile communities, especially in conflict zones, in areas where we cannot get to them? They're the ones who are not being immunized. Guess what? They're also the ones who aren't getting TB treatment. They aren't getting HIV treatment, and they're definitely not getting malaria prevention or case management. So I think we have this extraordinary opportunity to use integrated touch points. Every time we go into a community, you can't talk about just one disease. You have to talk about what is it that affects those communities. We've got to use primary healthcare systems, and we have to mutually leverage each other's strengths. Everyone always forgets that the E in UNICEF is for emergency. It gives us a great wherewithal because we never leave. UNICEF never left Somalia in the height of its most severe fighting. So we have these extraordinary colleagues. My colleagues are amazing people within UNICEF. They work so hard and they're always present. And they're there making sure children wash their hands, get to school, get food, and get malaria prevention. They're also out there fighting against prevention of mother-to-child treatment for HIV. They're also out there doing ring fencing for immunization, ring fencing for pediatric TB. It's an extraordinary opportunity to truly put together and get malaria off the map everywhere.
Wow, thank you both. I mean, I think you both so powerfully underscored just the uniqueness of this moment we're in right now, and over the next several months, how much there is this opportunity to really do things dramatically differently, and to overcome some of the barriers and the incremental progress that has, while good, just only been incremental for far too long. I want to ask you one final question. You have gathered, listening to you online, an incredible diversity and breadth of champions, experts, advocates. And I just want to ask you finally, in closing, what essential messages do you want to give to our summit participants? What do you want them to walk away with as their charge for action? Valentina, I'm going to go first to you, and then we'll close with Peter.
So in the nearly 2 decades that I have been working on malaria, colleagues working at the Global Fund, PMI, UNF, and Nothing But Nets have made the tagline, malaria is preventable and curable, a reality. It's an extraordinary, extraordinary moment. We're seeing more and more children come up malaria diagnostic, an RDT, negative. That is a historical, incredible achievement. For me, my mother is from El Salvador. My grandfather was a district health medical officer, and he used to tell me stories of fighting malaria. El Salvador was just declared malaria-free a few weeks ago. I want one day the birthplace of my children, Kenya, to also reach that historical achievement.
Wow, thank you so much. Peter.
I just want to echo Valentina's joy at El Salvador's announcement, and I think it's a fantastic achievement, and it's once again proof that it's doable. It's absolutely doable to get rid of malaria. Look, over the last 12 months, everybody on this call has experienced what it's like to have a life dominated by an infectious disease. It's scary, it's irritating, it's frustrating, it means you can't do the things you would like to be doing, sending your kids to school, working in the way you would want to work. Welcome to the world that communities in places that malaria is highly prevalent. Welcome to their world. That is what they live with every day, every year. Of course, the wrinkles of it are different, but malaria is an oppressive presence. It's a huge burden on the lives of individuals, of families, of communities. And I hope we take, in the same way that there is this massive mobilization of science, of resources, of governments, of everybody, to say, well, we can't live with this with COVID. We've got to get our lives back to normal. And so we should take from the urgency, the problem solving, the new salience of global health, the sense of solidarity across the world, not just the determination to get rid of COVID-19, but also to get rid of malaria.
Well, thank you so much to you both. This conversation was just fantastic. It was substantive and inspiring in equal measure. And really, thank you for being here with us. Thank you for everything that you've done throughout your careers and every day in the fight against malaria, the fight against COVID, and all of the work you do to support the most vulnerable people and populations and communities everywhere. I think you've left us with a very strong message that we do have a truly unique opportunity right now. Obviously, to finish the job on COVID, which isn't yet done, but also to use the new insight, the new empathy, the new urgency that we are gaining in the course of this terrible pandemic to renew our determination to end a disease like malaria that shouldn't be punishing communities worldwide the way it continues to do. And that the only way to get there, the only way to build stronger, more resilient systems, and the only way to ensure that we truly leave no one behind is by working together and uniting for the health and well-being of all. So thank you for everything you do every day to that end, and thank you again for joining us.